Welcome to the Allergy Department Immunotherapy presentation. In these slides, we will discuss treatment options for allergies, review the process of receiving allergy shots, discuss possible reactions to the allergy shots and their treatment, identify situations when you should not have an allergy shot, inform you of what you should report and when, review the days and hours you can come for your shot, discuss the consent form, and cost share. There are several treatment options for your allergy depending on the severity and duration of your symptoms. The basis of all treatment is the avoidance of offending agents. While complete avoidance is sometimes impossible, many measures can be taken to reduce your exposure. When your symptoms are not relieved by environmental control alone, medications such as inhaled nasal steroids, antihistamines, and antihistamine decongestant combinations are often prescribed. These medications are usually effective, but like all medications, may have undesirable side effects. For people whose symptoms are not well controlled by avoidance measures and medications, or who do not wish to use medication regularly, immunotherapy or allergy shots is an option. Allergy shots are rarely prescribed for skin allergy and never for food allergy. With allergy shots, minute amounts of the most important agents causing your symptoms are injected at regular intervals. There are generally two phases to immunotherapy. The first stage is the build-up phase. In this phase, you will receive injections with increasing amounts of the allergens. The frequency of injections during this phase generally ranges from 1 to 2 times a week. The duration of this phase depends on the frequency of the injections, but generally ranges from 3 to 6 months. The second stage is the maintenance phase. This phase begins with the effective therapeutic dose is reached. The effective maintenance dose is different for each person, depending on their level of allergen sensitivity or how allergic they are to the allergens in their vaccine, and their response to the immunotherapy build-up phase. Once the maintenance dose is reached, there will be longer periods of time between immunotherapy treatments. The intervals between maintenance immunotherapy injections generally ranges from every 2 to every 4 weeks. Your allergist will decide what range is best for you. About 3/4 of the patients who have this treatment show a significant improvement after 1 to 2 years. If there is no improvement after 2 years, your physician will discuss discontinuing your shots. As in all treatments, there is possibility of undesirable effects. These reactions vary from lumps at the site of the injection, what is referred to as a local reaction, to systemic or generalized reactions. Local reactions are not dangerous, but may be uncomfortable. For discomfort from local reactions, hydrocortisone cream and/or an ice pack may be applied to the site. For frequent local reactions, our allergist may advise you to take a non-sedating antihistamine before your shots. You may still use sedating antihistamines if a non-sedating histamine fails to prevent the local reaction. Always check your arm 20 to 30 minutes after injections for local redness and/or swelling using coin sizes as a reference. Continue to check your arm 2 to 3 times throughout the day. Whenever you experience a delayed local swelling in area larger than the size of a quarter, redness, itching, or pain after leaving the allergy department, please call the allergy department or send a secure message to your allergy doctor. This will allow us to make dosage adjustments before your next shot and therefore avoid delays. You should tell the nurse which arm the lump occurred and if applicable, whether the lump was at the site of the upper or lower injection. Within that time period it occurred, for instance, within 4 hours of your injection, and how long it lasted, for instance, more than 48 hours. Systemic or generalized reactions are another type of reaction to shots that occur away from the site of the injection. These reactions can be life-threatening, however rare. Most, but not all systemic reactions occur within the first half hour after a shot. Early treatment is very important if you are having a systemic reaction. It is for this reason we insist you remain in the allergy waiting room 30 minutes after your shots. If you have not had a reaction before the end of the 30-minute waiting period, all patients must be checked by the nurse before leaving the allergy department. Failure to cooperate with this critical safety measure will force us to stop your treatment. How do you know if you are having a systemic reaction? If you are experiencing any new symptoms after your shots, you may be having a systemic reaction. Some examples are respiratory symptoms such as shortness of breath, throat tightness, wheezing, cough, or a high-pitched sound when you breathe. Skin symptoms as seen with hives, itching, rapid swelling, for example of the hands, feet, and face, generalized itching away from the shot site, flushing or reddening of the face, neck, or upper chest. Eye or nasal symptoms as evidenced by a runny nose, red eyes, congestion, or sneezing. Cardiac or vascular symptoms such as feeling faint, chest discomfort, dizziness, or headache. Other symptoms that should be acted on include difficulty swallowing, abdominal pain, nausea, vomiting, diarrhea, diaphoresis or excessive sweating, anxiety, or feeling weird. If you have a systemic reaction and you are in the allergy department, you should immediately walk up to any staff member and say, "I think I am having a reaction to my allergy shots." If you have already left the allergy department, go to the nearest emergency room or call 911 and inform them that you are having an allergic reaction to your shots. On the way, you should take an antihistamine such as Benadryl, and if you have asthma, an inhaler which you should carry with you on the day of your injection. Please do not come back to the allergy department unless you have just left the clinic, as we may be closed. After a systemic reaction, you must make an appointment with the allergy physician before continuing shots. There are 4 situations when you should not have a shot. First, if you have a temperature over 100 degrees. Second, if you are wheezing. In this case, we will have you see the physician. Third, you should not have a shot if you have another injection such as travel shots, immunizations, flu shots, local anesthesia for dental work within 24 hours before or after your allergy shot. And finally, you should not have a shot if you are on beta blocker medication. When in doubt as to whether you should have your shots, you may call our clinic and speak with a nurse. Please note, you may take oral allergy and asthma medications while getting shots. Every time you come in for your shot, you need to let the nurse know if you had any reactions after you left the allergy department the last time you had a shot. You will also be asked to complete a questionnaire indicating how you are feeling and if there have been any problems or changes. Please provide accurate answers on the questionnaire each visit. In order for you to avoid delays in your shots, we ask that you call the department ahead of time if you have a delayed local reaction. This would be for any local swelling larger than the size of a quarter, redness, itching, or pain noted after you leave the allergy department. Also, to avoid delays, please call the department if you are not on maintenance and have not had a shot in 30 days, or if it has been 8 weeks and you are on maintenance. Another time to call the department ahead of time is if you are experiencing more allergy or asthma symptoms than usual and you want to have a shot. Please remember, you must also call the department before your next shot if you had a systemic reaction. We will book an appointment for you to be seen by your allergist. You will not receive allergy shots until your allergist provides further instructions. We ask you to note that the clinic hours and the shot hours are different. On this slide, you will see times that shots are given. These hours are also available on handouts provided by the allergy department. At your first shot appointment, you will be asked to sign a consent. By signing this consent, you are acknowledging that you understand the risks, benefits, and alternative treatments as provided by your allergy doctor, that you give consent to the administration of allergy shots, that you agree to wait 30 minutes after your shots and promptly report any adverse reactions. Your nurse will review this form with you. The cost share for your shot is not the same as a doctor's visit. You can obtain information about how much shots will cost from the allergy staff or member services. This is the end of the Allergy Department Immunotherapy presentation. If you have any questions, please be sure to ask your nurse at your visit. We look forward to working with you and taking care of your allergies.